This morning, I am doing some extra work for you. I'm answering questions that you have for Dr. Finder about liposuction. Dr. Finder is joining us this morning with the Face and Body Place. It's good to see you.
Good morning.
You know, people have questions. Sometimes it's hard for them to ask. They get scared or embarrassed. Liposuction has become a very common procedure. You have been doing this since 1995.
Yes.
Wow.
Yes.
Okay, and you've done close to 7,000 procedures. That's a huge deal.
It is.
Okay, so I can call you an expert for sure.
I think so.
Absolutely. Okay, so let's talk about the safety of liposuction. I think that's everyone's first question. How safe is liposuction?
Liposuction, the way I do it, an awake patient, local anesthesia, no general anesthesia, no IV sedation, is incredibly safe.
Okay.
It is safer than almost anything.
Wow, that is good to hear.
When it comes to a surgical procedure, considering that it is minimally invasive, we're removing something from the body, the subcutaneous fat, it's hard to beat it for safety.
Okay. What about, you mentioned awake, and I know that is a way to do the procedure. Do you feel anything? Do you feel pain if you're awake?
Well, when you're awake, I say this to patients. I ask them, if your teeth get numb at the dentist, which they say, yeah, my teeth get numb at the dentist, I say, your fat will get numb. And once your fat's numb, you're just feeling a little movement and pressure. It's really easy.
Okay.
So you don't have the risks of general anesthesia, which really, when you have any surgery, no matter what it is, liposuction or anything else, it's often the general anesthesia that's really the risk.
Okay. Okay. Is liposuction for everyone?
It isn't for everyone.
Okay.
Liposuction is a way to remove localized fat depositions. It's not a weight loss procedure.
Okay.
It is not for somebody who needs to lose more than about 25 pounds. If you're within about 25 pounds, that's probably a good place to say, yeah, I should seek asking about liposuction. It's not a skin tightening procedure either, so that's really important. And what's important is that whoever evaluates you, it should be the doctor, not a salesperson.
Okay.
And it's really the experience of the physician who needs to determine, are you a good candidate? Are you going to get what you want to get from liposuction? Or should you do something weight loss? Should you have a tummy tuck because you need to have skin removed? Okay. And really only a doctor can do that.
I want to show some before and after pictures because you can really get an idea about the success that you can have with liposuction if you are a good candidate. This is a huge difference here.
Yeah, and that's a very realistic type of person who comes to see me. You know, someone who's a little older, has had children.
We've got another before and after. Again, you can really see the difference there.
Yes, absolutely.
And liposuction works on various body parts too, right?
It does, yeah. So that, you know, little subtle amount of fat on the outer thigh is nicely reshaped.
What about these, the bat wings? You can take care of those too.
Yes, as long as the skin has enough tone to it, we can.
So I've been hearing about something called cool sculpting. What's the difference between cool sculpting and a liposuction?
Cool sculpting is an adapter that is basically suctioned onto your fat. It sucks you up into this device. It literally freezes it. Freezes it. It's like a hard rock of ice when you're done.
Oh.
Yes. A lot of people don't realize that. It's a little disconcerting.
Okay.
But it can only remove no more than about 20% of the fat with a cycle of cool sculpting. So with liposuction as I do it, I can remove 85% of the fat in one session.
Oh, wow.
Versus 20% with cool sculpting. So you need to repeat those sessions of cool sculpting over many, many months. So if you do one liposuction versus one cool sculpting, we'll be, you know, done with all your fat, you know, within weeks of healing.
Right.
You have to keep repeating over months those cycles.
Oh.
So
is it less expensive, the cool sculpting?
Well, see, that's the thing. One cycle might be less expensive, but to really get equivalent results over the amount of surface area that I can do at one time with liposuction, it really isn't less expensive by the time you go through all the cycles you need to do. I see patients in my practice who didn't understand that going into it. And now they're like, now I'm frustrated, now I'm going to come get liposuction.
That's why it's important to sit down with someone who knows exactly what she's talking about and someone who has done so many different procedures, like close to 7,000 liposuctions. So good to see you. Thank you for coming this morning. Thanks for answering all the questions.